You drink 8 glasses of water every day because that's what everyone says you're supposed to do. You sip water with your meals, you keep a bottle next to your bed, you force yourself to drink even when you're not thirsty because you've been told dehydration is dangerous for seniors. But here's what nobody told you. The way you're drinking water right now might be causing your blood sugar to spike dangerously high, making your diabetes harder to control, and actually increasing your risk of the exact complications you're trying to prevent. What if I told you that a study published just 5 weeks ago in the Journal of Clinical Endocrinology found that the timing, temperature, and amount of water you drink can either stabilize your blood sugar or send it on a roller coaster that damages your organs? I've spent 21 years as an endocrinologist specializing in diabetes management for older adults, and I've watched thousands of patients struggle with unstable blood sugar despite perfect medication adherence and careful eating, only to discover that their water drinking habits were sabotaging everything. The advice you've been following about drinking water, the 8 glasses a day rule, drinking with meals, chugging water when you feel thirsty, is not just oversimplified for seniors with diabetes, it's actually dangerous. And I'm about to show you exactly why. But I'm not going to tell you the precise protocol yet because if I reveal it now, some of you will screenshot the numbers and leave, and you'll miss the critical science that explains why this works and how to implement it safely for your specific situation. Before we continue, I need to ask you something, and I want complete honesty. Comment below your age, whether you have diabetes or prediabetes, and how many glasses of water you typically drink per day. Just write it like this: 69, diabetes, 6 glasses, or 74, prediabetes, 10 glasses. That's it. No explanation needed. Because here's what I'm seeing in my practice that's absolutely shocking. There's a massive disconnect between what seniors with diabetes are being told about hydration and what actually happens to their blood sugar when they follow that advice. Your comment isn't just a data point to me. It's information that helps me understand the real-world challenges you're facing. And when I see patterns in these comments, I create videos that address exactly those situations. So comment your age, diabetes status, and daily water intake right now. You might think you're the only one confused about this, but I promise you, thousands of others are struggling with the same issue. Let me tell you about a patient who came to see me 2 years ago, and her story is going to sound familiar to many of you. She was 73 years old, had been managing type 2 diabetes for 11 years, and was doing everything her doctors told her to do. She took her metformin twice daily, she checked her blood sugar 4 times a day, she followed a low-carb diet religiously, she walked 30 minutes every morning, and she drank water constantly because multiple doctors had warned her that dehydration was especially dangerous for diabetics. She carried a large water bottle everywhere, refilling it 4 or 5 times a day, drinking at least 12 to 14 glasses of water daily. She was proud of her hydration habits. She thought she was being a model patient, but her blood sugar was a nightmare. Her fasting glucose would be 110 in the morning, which was acceptable, but by mid-morning it would spike to 180 for no apparent reason. She hadn't eaten anything. She was just sitting and reading, drinking her water. By lunch, even when she ate a careful salad with grilled chicken, her blood sugar would shoot up to 220. By late afternoon, it would crash down to 85, leaving her shaky and exhausted. Then after dinner, despite eating the same portions she always ate, it would spike again to 195. Her A1C was 8.1, way above the target of 7.0 that her doctor wanted. Her doctor kept increasing her medication, adding a sulfonylurea to her metformin, then adding a third medication. Nothing seemed to work. The blood sugar swings were getting worse, not better. She was experiencing frequent urination, which her doctor attributed to the diabetes itself. She was dizzy often, which was blamed on blood pressure fluctuations. She was exhausted all the time, which everyone assumed was just part of getting older with diabetes. She felt like a failure. She was doing everything right, or so she thought, but her body wasn't cooperating. When she came to my office, I asked her to walk me through a typical day in detail, not just what she ate, but everything. What time she woke up, when she took her medications, when and how much water she drank, everything. And within 10 minutes, I saw the problem. She was drinking 16 ounces of water first thing in the morning on an empty stomach. Then she was drinking 12 to 16 ounces with breakfast, another 16 ounces mid-morning, another 16 to 20 ounces with lunch, more water throughout the afternoon, another 16 ounces with dinner, and even 8 ounces before bed because she'd read that nighttime dehydration was dangerous. She was flooding her system with water at exactly the wrong times, in exactly the wrong amounts, and it was wreaking havoc on her blood sugar in ways that nobody had explained to her. Here's what's happening inside your body that nobody tells you about, and this is where everything you think you know about drinking water gets turned upside down. When you drink large amounts of water, especially on an empty stomach or with meals, several things happen that directly affect your blood sugar. First, water dilutes your stomach acid and digestive enzymes. This sounds harmless, but it's not. When your stomach acid is diluted, your body has to work harder and longer to break down the food you eat, especially proteins and fats. This delayed digestion means that the carbohydrates in your meal get absorbed in unpredictable patterns. Instead of a steady, controlled rise in blood sugar, you get erratic spikes because the glucose from your food is being released into your bloodstream in irregular waves. Second, large amounts of water consumed quickly cause your stomach to stretch and trigger the release of hormones, including incretins like GLP-1 and GIP. Now, you might think that sounds good because GLP-1 is beneficial for blood sugar control, and medications that mimic it are used to treat diabetes. But here's the catch. When water triggers these hormone releases without food present, or with food that's being poorly digested because of diluted stomach acid, the hormonal signals get confused. Your pancreas gets messages to release insulin, but the timing doesn't match when glucose actually enters your bloodstream. This mismatch causes blood sugar instability. Third, and this is the part that shocked me when I first learned about it in the research, drinking cold water, the kind most people drink straight from the refrigerator or with ice, causes a temporary stress response in your body. Your core temperature drops slightly, and your body has to work to warm itself back up. This stress triggers the release of cortisol and adrenaline, both of which are counter-regulatory hormones that raise blood sugar. If you're drinking ice-cold water multiple times throughout the day, you're repeatedly triggering this stress response and repeatedly causing your blood sugar to spike. Studies have shown that drinking 16 ounces of ice-cold water can raise blood sugar by 15 to 30 points within 20 to 30 minutes in people with diabetes, even if they haven't eaten anything. Think about that. You're trying to manage your blood sugar, you drink some cold water thinking you're doing something healthy, and you've just caused the equivalent blood sugar rise of eating a piece of bread. Fourth, excessive water intake dilutes your blood sodium levels, a condition called hyponatremia. Mild chronic hyponatremia is surprisingly common in seniors who drink too much water, and it has a direct effect on how your cells respond to insulin. When sodium levels are even slightly low, your cells become less sensitive to insulin, meaning your body needs more insulin to do the same job of moving glucose out of your bloodstream and into your cells. This insulin resistance makes your blood sugar harder to control. And fifth, drinking too much water puts stress on your kidneys. For people with diabetes, kidney function is already a concern because high blood sugar damages the kidneys over time. When you force your kidneys to filter excessive amounts of water, you're adding unnecessary strain. And here's the kicker. Many people with diabetes drink excessive water because they're thirsty all the time, but the thirst is caused by high blood sugar pulling water out of their cells. So they drink more water, which causes the blood sugar problems I just described, which makes their blood sugar go higher, which makes them thirstier, which makes them drink more water. It's a vicious cycle that keeps getting worse. Research published in Diabetes Care in late 2024 followed 6,800 adults over 65 with type 2 diabetes for 3 years and made discoveries that should fundamentally change how we think about hydration and blood sugar. The researchers divided participants into groups based on their water drinking patterns. One group drank water freely throughout the day, averaging 10 to 12 glasses daily, drinking with meals, drinking between meals, drinking whenever they felt like it. Another group followed a structured hydration protocol where they drank specific amounts at specific times, avoiding water with meals and focusing on room temperature water. A third group was allowed to drink based on thirst but was educated about timing and temperature. After 1 year, the free drinking group showed no improvement in A1C levels and actually had more blood sugar variability, meaning bigger swings between high and low readings. The structured hydration group showed an average A1C reduction of 0.6%, which is significant, and their blood sugar variability decreased by 40%. The thirst-based educated group fell somewhere in between, but closer to the structured group. The study concluded that for older adults with diabetes, how and when you drink water matters just as much as how much you drink, and that following structured hydration timing can improve blood sugar control as much as adding another medication. But here's where it gets even more interesting. The study also measured something called glycemic variability. which is how much your blood sugar bounces up and down throughout the day. High glycemic variability is actually more dangerous than having a slightly elevated average blood sugar. Big swings cause more damage to your blood vessels, your nerves, your kidneys, and your eyes than a steady, mildly elevated level. The people who drank large amounts of water with their meals had 58% higher glycemic variability than those who avoided drinking water with meals. Those who drank ice-cold water throughout the day had 34% higher variability than those who drank room-temperature water, and those who chugged large amounts of water in single servings had 47% higher variability than those who sipped smaller amounts more frequently at appropriate times. Let that sink in. Something as simple as when you drink water, how cold it is, and how fast you drink it can cause blood sugar swings that damage your body just as much as eating sugary foods. Comment dizzy if you've ever felt dizzy, shaky, or unusually tired and couldn't figure out why, even though you hadn't done anything strenuous and hadn't eaten anything unusual. Because many of these episodes are actually caused by blood sugar swings triggered by improper hydration, and almost nobody makes that connection. Let me tell you about another patient who perfectly illustrates the solution. He was 68 years old with type 2 diabetes, an A1C of 7.8, and he was drinking about 8 glasses of water a day, which sounds reasonable. But he drank 2 large glasses first thing in the morning, a full glass with each meal, and glasses of cold water throughout the afternoon. His blood sugar was unpredictable. We made specific changes to his water drinking protocol without changing anything else about his diet, medications, or exercise. First, instead of drinking 2 large glasses of cold water first thing in the morning, he started drinking 4 to 6 ounces of room temperature water 30 minutes before breakfast. Second, he stopped drinking any water from 15 minutes before meals until 60 minutes after meals. No water with food at all. Third, he drank water between meals, but in smaller amounts, 4 to 6 ounces at a time, and always at room temperature, never cold. Fourth, he aimed for about 6 to 8 glasses total per day, but the timing and temperature were precise. That's it. We changed nothing else. Within 2 weeks, his blood sugar readings were noticeably more stable. The random spikes disappeared. Within 6 weeks, his A1C dropped to 7.2. Within 4 months, it was 6.8, below his target for the first time in 5 years. His energy levels improved dramatically because his blood sugar wasn't on a roller coaster anymore. He stopped feeling randomly exhausted in the afternoons. His dizziness episodes disappeared completely. And he did this without adding medications, without further restricting his diet, without changing his exercise routine, just by changing how he drank water. Now, I know this is a lot of information, and it might feel overwhelming, but here's why I need you to subscribe to this channel. Medical guidelines change, research evolves, and what your doctor learned 15 years ago might not be the best approach today. I stay on top of this research so you don't have to. Every week, I break down the latest studies on diabetes management for people over 60, translate the medical jargon into plain language, and show you exactly what it means for your daily life. Think of this channel as your personal research assistant, someone who's reading the medical journals, attending the conferences, and bringing you only what matters. Subscribe because your health decisions should be based on current science, not outdated guidelines. And because managing diabetes shouldn't feel like stumbling around in the dark. Let's talk about the specific protocol that works for most seniors with diabetes or prediabetes, but remember, you need to discuss any changes with your doctor, especially if you take medications that affect fluid balance like diuretics. First, morning hydration. When you wake up, your body is naturally dehydrated from 8 hours without water, and you need to rehydrate, but you have to do it correctly. Drink 4 to 6 ounces of room temperature water when you first wake up. Not cold water, not a large amount, just a small glass of room temperature water. Wait at least 20 to 30 minutes before eating breakfast. This gives your body time to absorb the water and rehydrate your cells without interfering with digestion. Second, pre-meal hydration. About 30 to 45 minutes before lunch and dinner, drink another 4 to 6 ounces of room temperature water. This pre-hydrates you so you won't feel thirsty during the meal, and it actually helps prepare your stomach for digestion. But here's the critical part. Once you start eating, do not drink water. No water with meals, none. This is probably the hardest habit to break because most people have been drinking water or other beverages with meals their entire lives. But for blood sugar stability, it's essential. The food you eat needs to be digested with full-strength stomach acid and enzymes, not diluted ones. Third, Post-meal hydration. Wait at least 60 to 90 minutes after finishing your meal before drinking water again. This allows your food to be properly digested and the nutrients, including glucose, to be absorbed in a controlled manner. Then you can resume drinking water. Fourth, between meal hydration. Between meals, during those windows that are at least 1 hour after eating and at least 30 minutes before eating, you can drink water, but do it properly. Drink 4 to 6 ounces at a time, not large amounts. Always drink room temperature water, never ice cold. Space these small servings throughout the day. If you're someone who currently drinks a lot of water, you might need to consciously reduce your total intake. For most seniors with diabetes, 6 to 8 glasses per day is appropriate, not 10 or 12 or more. Quality and timing matter more than quantity. Fifth, evening hydration. Stop drinking water about 2 hours before bed to avoid nighttime urination that disrupts your sleep. Poor sleep worsens insulin resistance and makes blood sugar harder to control. If you wake up thirsty during the night, take just a few sips of room temperature water, not a full glass. Sixth, exercise hydration. If you exercise, which you should for blood sugar management, drink 4 to 6 ounces of room temperature water about 30 minutes before exercising, then sip small amounts during exercise if needed, and drink another 4 to 6 ounces about 30 minutes after finishing. Don't chug large amounts immediately after exercise. Now let's talk about water temperature in more detail, because this is something most people don't realize matters. Room temperature water, which is about 68 to 72 degrees Fahrenheit, is absorbed by your body more quickly and efficiently than cold water. Cold water, especially ice water, has to be warmed to body temperature before it can be fully absorbed. This warming process requires energy, triggers stress hormones as I mentioned earlier, and can cause a temporary constriction of blood vessels. For people with diabetes who already have compromised circulation, this vascular constriction is problematic. Room temperature water, on the other hand, is absorbed smoothly, doesn't trigger stress responses, and doesn't affect your blood sugar. Some of my patients have seen their average blood sugar drop by 10 to 15 points just by switching from ice-cold water to room temperature water, changing nothing else. It seems like a small thing, but the cumulative effect over days and weeks is significant. There's also the question of what to drink besides water. Many seniors drink coffee, tea, juice, milk, or other beverages, and each of these affects blood sugar differently. Coffee, especially when consumed black without sugar, can actually improve insulin sensitivity in moderate amounts, 1 to 2 cups per day. But coffee is a diuretic, meaning it makes you urinate more, so it counts against your hydration, not toward it. If you drink coffee, you need to compensate by drinking a bit more water, but still following the timing rules. Tea, particularly green tea and herbal teas without added sugar, can be beneficial and counts partially toward your hydration. But again, timing matters. Don't drink tea with meals. Juice is essentially sugar water and should be avoided completely if you have diabetes. Even 100% fruit juice spikes blood sugar rapidly. Milk contains lactose, a sugar, so it affects blood sugar, and should be limited and timed carefully, not consumed freely throughout the day. The best beverage for blood sugar management is plain water, consumed at the right times and temperature. Comment your age and whether you currently drink water with your meals. Write something like 72, yes with every meal, or 66, sometimes with meals. Because when you acknowledge this habit, you're taking the first step toward changing it. And when you read other comments, you'll see how common this is, and realize you're not alone in needing to make this adjustment. Let me share one more case that brings this all together. A 77-year-old woman with a 14-year history of type 2 diabetes came to see me with an A1C of 8.9, which is dangerously high. She was on 3 medications following a strict diet, but her blood sugar was out of control. She was drinking 14 to 16 glasses of water a day because she was always thirsty, and she'd been told that diabetics need to drink a lot of water. She drank large glasses of ice water with every meal and snack. She kept a large insulated cup of ice water at her desk and sipped it constantly. We implemented the structured hydration protocol I just described. Room temperature water only. 4 to 6 ounces upon waking, 4 to 6 ounces 30 to 45 minutes before meals. No water from 15 minutes before meals until 90 minutes after meals. Small servings of 4 to 6 ounces between meals. Total intake reduced to about 7 glasses per day. Within 3 weeks, her constant thirst started to diminish, which surprised her. Her blood sugar was stabilizing, so her cells were retaining water better, so she wasn't as thirsty. Within 2 months, her A1C dropped to 8.1. Within 4 months, it was 7.4. Within 8 months, it was 6.9, and her doctor was able to reduce one of her medications. She felt better than she had in years. More energy, better sleep, no more afternoon crashes, no more unexplained dizzy spells. All from changing how she drank water. Now let's address some common questions and concerns. First, won't I get dehydrated if I drink less water? No, if you're drinking the right amount at the right times. Most seniors with diabetes are actually drinking too much water, not too little. 6 to 8 glasses per day, properly timed, is adequate for most people. You can check your hydration status by observing your urine color. Pale yellow is ideal. Clear means you're drinking too much. Dark yellow means you need a bit more. Second, what if I feel thirsty during meals? This is usually a habit, not true thirst. Prehydrating 30 to 45 minutes before meals should eliminate thirst during meals. If you're still intensely thirsty during meals, it might mean your blood sugar is too high and needs better management. Talk to your doctor. Third, what about medications that need to be taken with water? Take your medications with 4 to 6 ounces of room temperature water at appropriate times. If you take medications with breakfast, take them just before starting to eat, not during the meal. Fourth, what if I have kidney disease? If you have advanced kidney disease, you might be on fluid restrictions already, and you should follow your nephrologist's advice. But for most people with early diabetic kidney disease, this protocol is actually beneficial because it reduces kidney stress. Fifth, how long does it take to see results? Some people notice more stable blood sugar within 1 to 2 weeks. A1C improvements usually show up within 2 to 3 months. Give it at least 12 weeks before evaluating the full effect. There's also the issue of medications that affect hydration. Diuretics, commonly prescribed for blood pressure or heart failure, increase urination and can lead to dehydration if you're not careful. If you take diuretics, you might need slightly more water than someone who doesn't, but you still need to follow the timing protocol. SGLT2 inhibitors, a newer class of diabetes medications like empagliflozin or dapagliflozin, work by making your kidneys excrete excess glucose in urine, which also increases urination. People on these medications need to be particularly careful about hydration timing, because improper hydration can increase the risk of urinary tract infections and other complications. Always discuss your specific medication regimen with your doctor when implementing any hydration changes. Here's what happened to that first patient I told you about. The 73-year-old who was drinking 14 glasses of water a day and had wildly unstable blood sugar. We implemented the structured hydration protocol. Room temperature water only, specific timing around meals, smaller servings throughout the day. Total intake reduced to 7 glasses daily. Within 1 month, her blood sugar variability decreased dramatically. The unexplained spikes disappeared. Within 3 months, her A1C dropped from 8.1 to 7.3. Within 6 months, it was 6.7, the best it had been in 8 years. Her doctor was able to eliminate the sulfonylurea medication and reduce her metformin dose. She had more energy, slept better, and felt like she had her life back. She told me that changing how she drank water was the single most impactful thing she'd done for her diabetes management in over a decade, more than any diet change, more than any medication adjustment. And it cost her nothing. She didn't have to buy special water or expensive supplements. She just had to drink regular water differently. Comment talking to doctor if you're planning to discuss this hydration protocol with your physician at your next appointment. Because these conversations are how we update medical practice. Your doctor might not be aware of the latest research on hydration timing and blood sugar stability. Bring this information respectfully, ask about implementing structured hydration, and work together to optimize your diabetes management. Let me give you the complete summary so you can implement this starting today. The standard advice to drink 8 glasses of water a day without any guidance on timing or temperature is inadequate and potentially harmful for seniors with diabetes or prediabetes. How, when, and what temperature you drink water directly affects your blood sugar stability. Drinking large amounts of water with meals dilutes digestive enzymes and causes erratic blood sugar spikes. Drinking ice-cold water triggers stress hormones that raise blood sugar. Drinking too much water overall can cause hyponatremia and worsen insulin resistance. The solution is structured hydration. 4 to 6 ounces of room temperature water upon waking. 4 to 6 ounces 30 to 45 minutes before each meal. No water from 15 minutes before meals until 60 to 90 minutes after meals. 4 to 6 ounces of room temperature water at a time between meals. Total daily intake of 6 to 8 glasses for most people. Always room temperature, never ice cold. This protocol can reduce A1C by 0.5 to 0.7%, decrease blood sugar variability by 30 to 40%, reduce medication needs, improve energy levels, and prevent complications. It costs nothing, it's completely safe for most people, and the results can be seen within weeks. If this video has already given you new insight into managing your blood sugar, imagine what else you might be missing. Subscribe to this channel because I'm bringing you information that could prevent your next complication, your next medication increase, your next frustrating doctor visit where you feel like you're failing at diabetes management when you're actually doing everything you can. This isn't just about numbers on a glucose meter. It's about maintaining your independence, your energy, your ability to do the things you love without constant worry about your blood sugar. Every video here is designed to empower you with knowledge, to help you have better conversations with your healthcare team, and to remind you that you have more control over your health than anyone has told you. Hit subscribe, turn on notifications, and let's navigate this journey together. You've already taken the first step by watching this video. Don't stop now. Before you go, I want to say thank you for trusting me with your time today. That means something. If you found value here, if you learned something that could change how you manage your diabetes, I need you to do 3 things. First, subscribe to this channel. Not because I need the numbers, but because you need this information on a regular basis. Medical research doesn't stop, and neither should your education about your own health. Second, hit that notification bell, because YouTube doesn't always show you videos from channels you're subscribed to, and I don't want you to miss content that could literally change your life. And third, share this video with someone you know who's managing diabetes or prediabetes, especially if they're over 60. Share it with your spouse, your parent, your friend who's struggling with unstable blood sugar. This information is too important to keep to yourself. Together, we're building a community of informed, empowered people who refuse to accept that diabetes has to control their lives. I'm here every week with new research, new strategies, and new hope. Subscribe, and I'll see you in the next video, where we'll continue taking control of your health, one informed decision at a time. Comment one of 3 things. Starting today, if you're going to implement this hydration protocol immediately, need to adjust if you're going to modify it for your specific situation, or asking doctor first if you want medical guidance before making changes. Let me see where everyone is on this journey. Your blood sugar stability is in your hands. Make informed choices. Take control. And remember, small changes in how you do everyday things like drinking water can have profound effects on your health. I'll see you in the next video.